Hi, I wanted to go over this week's soap note, and hopefully this will help clarify a lot of problems that people are having with these. Now, last semester we did the case studies, but I really didn't make you do soap note format. So this time it is a bit of a learning curve. Most of you should have had some soap noting in your undergraduate, but it might have been a while. And this is a little different doing it as a provider. So also, one of the things that we want to think about is that we are training you to be primary care nurse practitioners. So you need to look holistically at the person, all right? So we talked about this some in pathophysiology, but it's going to be a theme that you're going to continue on learning. And this is something that our preceptors also want you to realize and be cognizant of. All right, so this is one of your soap note from one of your classmates. And anyways, I just wanted to review this one. This was a very exceptional one. So first of all, you got your chief complaint. Should be 1 or 2 words. Head congestion. Perfect. Then you want the history of present illness. Symptoms started with a runny nose, cough about a week ago. 2 days ago you had a headache. This worse, or she, when she's bending over. The Tylenol is relieved by the headache's relieved by Tylenol, and that she's been taking Sudafed and Afrin. So the one things I want you to pick up here is she's taking Sudafed and Afrin. So hopefully you're learning, and most of you guys put this in here, but if you didn't, I probably put a mention about this, is Afrin is something we have our patients use on a long-term basis. This can be very nasal addicting and can be very difficult to get off of. Sometimes it can take months to wean yourself off of the Afrin. So if they're using it more than 3 days is kind of my cutoff, and probably literature says about 5 days, but really you don't want it very long at all. It doesn't take long for your nose to get addicted to this. So this should have raised a little bit of red flags for you, okay? And then Sudafed, okay, which a lot of people take with cold, no problem there, all right? Then you've got past medical history. And some people had, reoccurring sinusitis times 10 years, treated for sinus a month ago. And some people put that this treated for sinusitis a month ago as part of the present illness. Some people put it past medical. You could argue both, so, either one's okay, because this is probably related to the present problem, but it also is a past problem. I don't care. That, as long as it's in there somewhere. Some people didn't put a history of present illness or past medical history or a family history or a social history, and those are important to put in your soap note. If you don't know about it and it's something that would be important to know, then you want to include in there, like, what would you like to know about that particular, that would help you with that visit for today, okay? So, so one thing that you might want to know about this is recurrent sinusitis for 10 years. Now, for some people, a recurrent sinusitis is I had one 2 years ago and I had one 2 years before that. So it's like every 2 years, but for the last 10 years. Some people, it could be I had one a month ago. It was probably 2 months before that, 6 or 7 times a year. So you really want to define what that is. And the best way to do that actually is to get their past medical records or look at their records. So that might have been something you wanted to put here, like, I really need to know how often this is, because it makes a difference to diagnosis, all right? Then current medication. You got to put that down, always. So, he's got Tylenol. She wants to know how often. Sudafed, how much and how often. Afrin, how often. These are really important to know, because if you just, Afrin addiction alone can give you a terribly stuffy nose. I had one of my grandmas come in with this, and she wasn't my patient, but I was like listening to her talk. She could hardly talk because her nose was so stuffy from Afrin. After talking to me, she went and talked to her primary care provider, and they did a 6-month wean, and it was much better, lo and behold. And then you wanted to ask about other medications, because like somebody put in there, you'd want to know about an ACE inhibitor. blood pressure medication because it does make a difference. It could be part of the reasons why you have cough, although cough's not her main symptoms. But anyways, you want to ask about other medications. Allergies. Always, always, always ask about allergies. None noted. You want to ask about it. Absolutely. Past surgical history. I'd probably put this under past medical history, but, you know, it's okay. It's in here. It's fine. Family history. All right, so we want to know about mother, father, siblings, and children, because primary relatives. For her, I can't remember how old this lady was, but we probably would put the she may have it in here somewhere. Anyways, but I think this was an older person. Yeah, it is spoken like that. So you grandparents aren't probably going to be as important, and they're not really first degree relatives. You want parents, siblings, and children. Okay. Then this is cigarette smoking. It's a 54-pack year history, and she reports she wants to quit. All right, that's very significant for this problem. You've got recurrent sinusitis. What do we know that happens to the cilia in our nose or nasal passages with smoking? The cilia just quits working, right? So it's not going to move the mucus the way it should. So that's real important to this particular diagnosis, all right? Ethyl alcohol, and you'll see me do this over and over again, so just know, social drinking. I'll always ask, what is social drinking? Ask about drug use, living arrangements, or because some drugs, especially cocaine, that sort of thing, can give you runny nose, stuffy nose, that sort of thing. Okay? Then here is the biggest thing that people were mixing up on these things, is a review of systems. Part of your S, and this is really your S part here. This is all your S, but usually when if you write all this and then you'll put an S here, but it's kind of all the same thing, is your review of systems. And then you want to kind of go over your review of systems that relates to your chief complaint. All right, so you're not going to ask here, you know, if they're constipated because they're talking about this. But you are going to ask about, you know, just say, okay, it's frontal headaches worth with bending over. You know, that's kind of consistent with like a sinusitis. We leave with Tylenol. Eyes, you know, you want to report if they're itchy. She's seeing floaters. You know, maybe, maybe not. I don't know, but it's not going to hurt to ask about that. You're going to do an ENT type history type thing. So she's got ear pain, and then nose, you know, what they're telling you, they're blowing out their nose. And then we know that the color of the discharge really doesn't make any difference. It's how long it sits in the nose, but it can make a difference. Basically, when I look up turbinates and I can see the yellow, or thick yellow, mucusy, pussy looking stuff back inside their nose, or dripping down the back of their throat when you look at their throat, then, you know, that's a little bit more significant. But we do put that in here because that's what they're telling you. And then throat, and then neck and chest. So you're going to do a relative review of review of system. So yeah, you're not going to go into all this because if you ask her, you know, are you having problems with your bowel movements, you're going to hear about it and you probably don't want to know. Okay, so you just want to do that relative, but you do. But let's say they did have cough, then you would want to ask maybe a few more questions about chest pain and that sort of. All right, so then you come here to your vital signs. So her blood pressure's that important correlation there, right? And she has just a little low-grade fever, nothing to worry about, but she's really overweight, right? So we're going to talk about that BMI too, and we're going to think about that because we forget about these two things. All right. So then we're going to do our review systems, or our physical exam, which is our part of our objective here, and we're going to talk about what we know, and we're going to go through this down systematically. Now let me go back to the review systems up here. I put in your initial SOAP note in your course orientation to do a review systems, and then when I looked at the examples that I had, because I was like, well, maybe there's something going on there. The examples do it more in a narrative. This is a better way to do it because you can really go down and think about it, and it makes it just easier to see. They did those in the example, but they did it and more a narrative, and so you don't really want to repeat your history of present illness in your review of systems. Anyhow, so moving down to assessment. So your primary diagnosis, what they came in for. They came in because she was having head congestion. So your primary diagnosis based on your history, and you put the pertinent positives and pertinent negatives. And the big thing with sinusitis particularly is that you have this going on for a week. You got a nice citation here as to what's going on there. Perfect. Your secondary diagnosis, and this was one I hadn't even thought of, was nicotine dependence. Perfect. I love it. Because we should always be thinking about stopping smoking. Then your differential diagnosis here is, you could have the common cold, and you could talk about your pertinent negatives and positives. So your primary diagnosis, what they came in for, your secondary diagnosis, what else you found while they were there, your differential diagnosis is what these could be if you were wrong, okay? So if it's not sinusitis, it could be a cold, it could be allergies. Now, some people put down chronic sinusitis. This is where that history comes into play. This could be a chronic sinusitis, depending. Now, they had it last month. We know that the medication, from pharmacology, that the medication that they treated it with, amoxicillin, is not the one that's the guidelines say we should be using for sinusitis. So it might have just been undertreated, and that's why it never got better. It could be really just the same acute sinusitis just hanging on because it just didn't get treated correctly. With the 10-year history of sinusitis, it could be chronic sinusitis. We really need to know more about the history on there. Like, do they really have it like 4 or 5 times a year? Do they ever clear up well between times? And given her smoking history, it's very, very likely that this is chronic, right? So anyways, either one of those worked. You just kind of had to explain it. The other thing that I really wanted on secondary differential on here is I really wanted you guys to address, we're primary care providers. This is our patient. We're going to come in there and go, whoever, you're here. I see, you do have sinusitis. Maybe the medication that you took last time, the bacteria wasn't sensitive to. But I also see your blood pressure is kind of elevated and you're on Sudafed. So we need to figure out whether it's the Sudafed causing this, or do you really have high blood pressure or something else. So we need to bring you back in and check this again. We need to have that noted. And then also, and I can kind of see, I see your BMI's up a little bit, maybe it's down, who knows, but up a little bit. And so we probably need to go ahead and schedule a well if you haven't had one, so we can kind of talk more about diet and exercise and, healthy living and that sort of thing. Or maybe this is down, who knows. And then you go, great, but you need to mention that you've paid attention to that. Now, they got it in red, so I know they paid attention to it, but I really wanted you to have something in writing about that. So we have primary, secondary, differential, and they didn't put that on here. And then we have plan. So you have your non-therapeutics, talking about rinsing sinus. Lots of evidence for this. Good. But then they've got it. Their evidence here. Some people had treatment plans and they didn't put where they got it from. You really need to put where you got this from. Okay? Educate to stop smoking. If he didn't have that referenced here, or she didn't have that, he didn't have this referenced here, that would be okay with me because I think that's pretty basic knowledge all of us know. But he does have it referenced, which is great. OTCs today. So he's got Tylenol, how to do it, works for me. Motrin, how to do it. Nasal solution, how to do it, no problem there. Now this person didn't want to treat with antibiotics at this time, and they would follow, and they, if no reliable follow-up, would do antibiotics at that time. And then he put what he would have given. Okay, I don't think this is necessarily bad. However, given this situation with this patient, smoking history, we know their cilia is not working very well. I would have probably treated this patient. Is it terrible to just say, let's wait a little while longer because we don't always need to treat sinusitis with antibiotics. Not terrible, but I'd make sure that I have some sort of follow-up plan. Now, what I do with patients sometimes is people don't like to go out with this kind of situation where you're kind of going, if you're not better, so you could have, if you're not better, you can call me and then I'll call you in something. But usually I wouldn't make them come back into the office to get this because they're going to be upset. And they've got 7 days of treatment, and he's got it cited, and I didn't check this citation here. Typically with sinusitis, it's difficult to treat, so I usually treat this for a full 10 days, but if you found the evidence here, that works for me. Diagnostic testing, really you don't. You can get this history from clinical, from this diagnosis from history and from clinical exam. But if you were going to do something, yeah, CT scan would be the way to go, and that's really the only way to 100% diagnosis. But we're not going to order CT scan every time somebody has a sinusitis. Now, if they did as some people put, a referral to an ENT, they may order one at that point, and that's fine. And I think that's what if I was going to that point and someone had chronic sinusitis, I'd probably refer them to an ENT. But you could order a CT scan if you were kind of like, I really think this is what it is. We've had this, this history, that sort of thing. And I'm going to get a CT first to document it, then refer them. That works too. Either way is fine. So this person hasn't come back to a recheck. Like I said, I probably wouldn't do this because you guys know you're already working in school. If you have kids or a husband or something like that, you don't want to go back for something like this. I would probably, if I was going to do this approach, have them call me back in, 7 days if you're not better, and then at that point I'll call you in something. But is this terrible? No, it's just one of those things that, in an ideal world this would work, maybe not so much in real life. And then we want to educate the person about a treatment plan. We want to talk to them about stopping the Afrin, and we also want to talk to them about stopping the Sudafed, especially with that blood pressure being so high. And we definitely want to fight with that blood pressure, and that could be something like tell them to go to CVS and check their blood pressure when they're not on the Afrin, and just give you a call, let you know what it's doing, or if somebody else in the family has a blood pressure, cuff or whatever, and kind of getting back with you. But they probably need to go ahead and schedule well if they haven't already had one scheduled. So some of that you just don't have enough information for. You don't know they could be coming in and be, up to date with their physical exams or whatever. So we need to know that. Then this is also what I wanted you guys to do, is write a little synopsis on how you would present this to your preceptor, because this is one of the biggest things we got back from preceptors, is that our students didn't know how to report their patients. So, and when you report this, you want to go, you are the provider now. So they're kind of talking about the symptoms, what's going on with it. I believe this is an acute sinusitis, or you could say chronic sinusitis, or some of the other things like that. Sinusitis makes the most sense here, either chronic or acute. Or you could say it's acute sinusitis. It could be chronic, I don't know. That's fine. And then, I want to send her home now, and I'm going to bring her back in 7 days. If not, and I'll order Augmentin at that time. I'm going to review smoking cessation. Perfect. So this kind of thing here is perfect, okay? And then the other thing that people were having problems with was still the references. Now, you do need a evidence-based practice reference. Up-to-date, great reference, not evidence, and it is evidence-based, but it's not an evidence-based practice reference as we define it in the graduate school in Anderson. And that's because we want, you may or may not have access to up-to-date. It's expensive if you get out of school. You may not want to buy it yourself. If you work for the hospital systems, you can get access to it, but you might not have access to it. So we want you to kind of be able to look up some of the how to do this. So one source that I really suggest people doing is American Family Physician. It's free. It's online. It's very, very user friendly. You can look up sinusitis in adults, sinusitis in kids. It'll give you practice guidelines. that sort of thing. So you can use your books here, no problem, but we want you to have one. And if you use American Family Physician every time, you've got it, right? Then the other thing that we're having a problem with is still having folks have issues with APA. So just make sure you're reviewing your APA, and just note that if it's an article name, like you wouldn't put acute with a capital S, acute sinusitis and rhinitis. You would have it exactly the way this is, with semicolon and then after that. Now, if it is a proper noun, then you're going to capitalize that. So if it was acute sinusitis of Jack Brown's Clinic, Jack Brown's Clinic would be capitalized because it's a proper noun, okay? And remember to use italics where you're supposed to use italics. So go back and look at that Purdue OWL for your APA formatting. That would be important. You might even want to bookmark that page and just kind of keep looking at it. But anyways, this is, this is a very good SOAP note. We see that there is, a few issues here, but overall a very good SOAP note. Some people, if you look at this now, maybe hopefully you can compare it to what you did, especially if you didn't get a particularly good grade on this one, and see where you could have some improvements made. But overall it's pretty good. Anyhow, I hope this helps you.